Good evening, Dr. KK here. If this is your first time on my channel, I will encourage you to subscribe, share, and then let others know what we are doing here. So the main purpose for this channel is to educate people on health issues. So I'm trying my best to give you the best of health information. So with this short video, I want to just give you a little bit of information on breast cancer, which is, per the statistics as of 2022, was the commonest cancer diagnosed in women, and it killed about 167,000 women. So let's also understand that in about 0.5 to 1% of the cases of breast cancer, it's diagnosed in men. So men are not exempted from breast cancer. So that's something we should take note of. And so when we talk about breast cancer, I'm sure most of us have an idea what a cancer is. It's an abnormal multiplication or growth of cells in your body. So if any part of your body grows in an uncontrolled way or abnormal way, it could be a cancer. So similar things happen in the breast tissue. And so when this happens, it comes up with some signs and then symptoms which the woman or the man will experience and then report it to the hospital. One of the commonest that is usually seen is when you feel a lump in your breast or a mass in your breast. So that's why we are mostly encouraged to do self-breast examination, so that if there's anything, you're able to pick it up. So that's the commonest. It's the commonest that's usually seen. The next is there could be some changes, some skin changes on the breast, which the woman can't see or the man can't see. And sometimes too is a large difference in size. I'm using the large because normally the breast may have some asymmetry or some difference in size, but that's not too significant, and that may not even be seen by an external person. So if you are seeing a significant change, sudden or gradual change in the size of your breast, is something you have to be cautious of and then investigate. Another thing is when you have nipple discharge. So nipple discharge, that's offensive, sometimes bloody, sometimes greenish. Those are not normal nipple discharge. The normal nipple discharge are clear, they have no odor, and then they are not too copious, except when probably you are breastfeeding. Then you may see some copious discharge from your breast. So if you are seeing any abnormal discharge from your breast, hey, please take it to the hospital, let it be investigated for you, so that if it's something that's dangerous, is taken care of for you. Another thing that people usually may present with is chronic or constant breast pain or recurrent breast pain. It may be a subtle growth that is not obvious to the touch. So if you are experiencing chronic pain in your breast, I'm not saying that all these things are definitively breast cancer, but you would have to get it investigated, so that if it is, then the earlier the diagnosis is made, the better for you, so that treatment can be initiated as early as possible. And to sign this caution, breast cancer is not a death sentence. Some people have been treated successfully and are free of breast cancer. So the fact that you are diagnosed of breast cancer doesn't mean you're going to die today or tomorrow. You can be treated successfully. I know a couple of people like that, and I know some people too who failed the treatment and unfortunately lost their lives. So those are some of the things that will show up when you are probably developing or have developed a breast cancer. Now, somebody may ask, what are the causes of breast cancer? To be honest, breast cancer doesn't really have causes, but we always talk about risk factors. When we talk about risk factors, we are referring to what will predispose the woman to getting, or the man to getting, breast cancer, or what makes one stand at a higher risk of developing breast cancer. Now, before I go to the risk factors, let's take note that in 2022, about half of the cases of breast cancer that were diagnosed were without any of these risk factors I'm going to mention. So the fact that you are free of these risk factors doesn't mean you cannot be diagnosed of breast cancer. So it's always important to get screened, self-breast examination and then intermittent screening, especially if you are able to do it once a year or twice a year. In October, breast cancer awareness is all over the place, and most of the hospitals do the screenings for free. Some institutions or organizations also organize free screenings. Please, let's take advantage of these. Very helpful. So the risk factors, one is the fact that gender is a risk factor. So the fact that you are a woman puts you at a higher risk of developing breast cancer. Also, advancing age is a risk factor. So relatively, somebody who is 30, someone who is 50, the chances are that the one with advanced age is likely to develop breast cancer. The next thing that is a risk factor is when you have your first child late. So anywhere around 35 and beyond, if that is when you had your first child, compared to somebody who had their first child around 2022, the one who had the first child around 35 stands at a higher risk of developing breast cancer. And then in relation to pregnancy, the earlier your first full-term pregnancy, that is a positive risk. It reduces your risk of developing breast cancer. And then the fact that you breastfeed your child exclusively or for a long period of time also reduces your risk of developing breast cancer. So comparatively, somebody who did not breastfeed at all compared to somebody who breastfed the child for a year, the one who didn't breastfeed at all stands at a higher risk of developing breast cancer. So this is something we have to also take note of. Other risk factors are cigarette smoking, obesity, sedentary lifestyle. All those are factors that increase the lipid content or cholesterol, what we commonly call cholesterol, or fat content in your body, and those put you at a risk of developing. So one of the other risk factors is when there's a family history of breast cancer. So with this family history, we are talking about your auntie, your sister, your mother, like first generation relatives, if there's a history of breast cancer, or if probably your uncle or someone has developed prostate cancer. So that's also, the prostate cancer will be one in males. So if that is also in the family, then that's a risk. It doesn't necessarily mean you are going to develop breast cancer. So these are risk factors. Let's take note of them. They are risk factors. So the fact that someone is having a risk factor doesn't mean the person is going to develop breast cancer. So let's take note of them. So I've already mentioned the smoking, all those things have already been mentioned. So let's also take note of them. Now, what do we do? What are you expected to do? The key is that most of the times in our part of the world, in Ghana, a lot of time people come late. People present to the hospitals at the latter stages when not much can be done medically about their situation. So I would encourage you that if you start seeing any of the signs and symptoms I mentioned earlier, please seek medical help. What we usually hear at the hospital is that somebody starts seeing some of these things and then they spend so much time with herbalists, at the prayer camps, a lot of places, and then they come in at the advanced stage, and then unfortunately there's not much you can do. So the key is that early diagnosis is a good prognostic factor. Early diagnosis means that you stand at a good chance of being treated. So when you see any of these, please go to the hospital. Go and get it checked up. Even if you haven't seen any of these, as I said earlier, regular screening is one of the key things that will help us to be able to detect any subtle growth in our breast and then take the necessary steps that have to be taken. Now, in terms of the treatment, there are various treatment modalities. So we have surgeries, we have chemotherapy, like radiotherapy, all those things. So that modality of treatment will mainly be based on the stage the cancer was diagnosed and the type of cancer. There are various types. There are even some that respond to hormones. So for those ones who treat with hormone therapy. So it's based on the type of cancer you have developed and the stage at which we are diagnosing it. So that is how the treatment goes, and it requires a lot of commitment with the treatment. You do a lot of cycles, and then so sometimes we do surgery before we start the chemotherapy. Sometimes we do chemotherapy for some time before we do the surgery, and then you continue with your chemotherapy. So these are some of the things that I want us to take note of when it comes to breast cancer. I know there are a lot of questions that we may want to ask. And so when you watch this video, you can share, you can subscribe, you can ask your questions in the comment section, and I'll be glad to answer.